Hello and welcome. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. So glad that you could join us. Our guest today is Ms. Amy Berman. She's the Senior Program Officer with the John A. Hartford Foundation, and she's joining us today to talk about creating a more age-friendly healthcare system for us older adults. Welcome to Health Professional Radio, Amy Berman.
Thank you, Neal.
Thanks for taking the time to talk with us today. Now, a Senior Program Officer, an SPO, what exactly is a Senior Program Officer?
I'm responsible for developing initiatives that the foundation funds. I also help run those initiatives and evaluate those initiatives, so different efforts that improve the care of older adults.
Are you a healthcare professional, say a nursing or a physician is in that capacity? Have you ever worked in that capacity at all?
Yes, I'm a registered nurse.
Okay. And was it your nursing experience that found you transitioning into the care of older folks, or is that something that you've always been interested in? Was there anything that was, a catalyst to pique your interest in this field?
I've always been focused on improving the care of older adults. I originally was a healthcare administrator, looking at the kinds of issues around care in the home care setting. And coming here to the John A. Hartford Foundation, this is a place that has national influence that helps hospitals and home health care agencies and nursing homes and places out in the community, primary care, improve the way in which care gets delivered so that people live better lives.
Are there any initiatives in place to educate both caregivers and potential older patients about how to, how to arrive at that elder age where that particular type of care is important, not just looking into it once you see that you're 60, 65 years old?
Well, one thing that might be helpful, they're welcome to look on our website, which is www.johnahartford.org, and they can read about the different things that are going on to improve healthcare's design, but they also can read the blog that we write, which covers a variety of issues, everything from family caregiving to the work that we're going to discuss today, which is around age-friendly health systems.
Now, when you say age-friendly, should I assume that the healthcare system as it stands now and possibly as it stood in the past is a little bit less age-friendly and geared more toward the health of younger people so that they can continue to be productive? Is that a fair statement, or am I off the mark a bit?
You are on the mark, Neal. Today, healthcare delivery, whether it's in the hospital or in home care agencies or in nursing homes, the care really is not well designed for older adults. And oftentimes the people working within healthcare don't have the basic competence around the care of older adults. So we need to, from a systems level, we need to make sure that these things are operationalized throughout a system so that people get better care consistently and also everywhere that they're being cared for.
How much, information, input, advice, what have you, does the John A. Hartford Foundation and you as the Senior Program Officer, how much information and support do you glean from older healthcare professionals themselves as they deal with some folks that are patients of theirs? Do you see things that make a light go on in their heads being older themselves, caring for people their own age?
What a great question, Neal. We do actually have within the work that we're doing a range of healthcare professionals that are engaged, both physicians, nurses, social workers, and people who are of different ages. So we also do have a number of advisors in this work that are they themselves older adults receiving the care. Some of them are healthcare professionals, but some of them also are patients and families that are helping to tell us what the design should and could look like.
There's so much talk in the news about the changing face of healthcare, and it's been changing over the last 15 years, almost constantly. When it comes to us older patients, for lack of a better term, falling through the cracks of the healthcare system, which is already strained when it comes to caring for us. What types of efforts are employed to kind of plug some of those gaps when it comes to focusing on age-friendly healthcare?
Well, there's some basic principles that we'd like to see in the design of healthcare systems so that they are age-friendly. The first thing is that we should know that people are able to get the best care possible. We should know that healthcare-related harms to older adults are dramatically reduced or approaching zero. I'm sure you know that there are a lot of things that we do that create harms in older adults. And older adults are satisfied with their care, and in the end, value is optimized. To do this work, we focused essentially on 4 different areas that we're calling the core elements of this prototype for an age-friendly health system. The first is kind of overarching, and it's what matters. It's knowing and acting on each person's specific health outcome goals and their care preferences. So the treatment should be aligned with what's important to them. The next area is around mentation. We want to focus on preventing things like delirium and managing care correctly when somebody has dementia. I'm sure you've heard about stories where people will bring in a tray and walk out and take the whole tray with them, never realizing that somebody didn't know how to how to feed themselves.
Yes.
And so we could potentially create other harms in care by not attending to the needs of dementia. Another area is mobility, and this is really not just preventing falls, but getting people up and out of bed consistently. So what's the mobility plan for an older adult when they're at home, when they're in the hospital? Wherever they are, we need to make sure that we are maximizing their ability to be up and active. And the last area is one that I'm sure you've heard a lot about, which is really around medications. Medications that conflict with one another. Sometimes people are given medications that are inappropriate to an older adult. They actually cause harm, and we know this. And health systems, across all different settings of care, they need to be tuned into what is really important to do for an older adult and also what is important to avoid for an older adult so that people are safe.
There at the John A. Hartford Foundation, you mentioned several aspects that are being focused upon when it comes to creating a more age-friendly atmosphere within healthcare. You mentioned dementia and not knowing how, or maybe forgetting how to feed oneself. What about some training and insight into some of the mental health issues that us older folks experience as we get on in age, that some of the younger practitioners may not have a clue as to, what's going on, not necessarily simply dementia, but also an underlying depression as well that needs to be addressed in order to maybe maximize some of the care that's being administered?
It is very, very common that people will see confusion and they will assume that it's dementia, but it may be actually depression, or it could be delirium, which is where something has happened, some underlying health issue that causes somebody to have temporary, kind of immediate onset delirium. And that, if it's not addressed, if they don't fix the medical cause, something as common as a urinary tract could cause that. They can get rid of that cognitive change. And so it's really important that the people who are caring for older adults understand how to recognize dementia, delirium, depression, pick them up, understand what the differences are, and understand how to address them, because some of these will be life-altering if they're not addressed.
And where online can our listeners go and get more information about the John A. Hartford Foundation and age-friendly healthcare design in general?
Well, they're welcome to come to our website, which is www.johnahartford.org.
Great. It has been an absolute pleasure speaking with you today.
Thanks so much, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Miss Amy Berman, Senior Program Officer with the John A. Hartford Foundation, and she's joined us today to talk about creating a more age-friendly healthcare system. Transcripts and audio of this program are available at healthprofessionalradio.com.au, also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.